personally from working with her, both with the Journal of Muslim Mental Health and Muslim Mental Health activity in general. She's a mentor internationally. I look forward to sitting down and talking to her about her experiences in Egypt, and I would hope that you approach her as well. And so she just is leading a new organization called the American Middle East and North African Psychological Association. Yet another development that hopefully is going to lead some more efforts in the Middle East. So without further ado, I'd like to welcome Amer.
Okay, that's what happens when somebody introduces you who knows you personally. So it's an honor to be here, and I want to thank Dr. Farha for inviting me. And this sort of is like a homecoming. I remember when I started the Muslim Mental Health Network in the year, I think it was maybe 2000, it was a very lonely field, barely knew anybody. At the time, the Islamic Social Services Association was doing some work, but for the majority of people who wanted to work in Muslim mental health, there wasn't really a network or a group of people that you could connect with. So it's very exciting to be here at the 10th anniversary of the conference. And what I wanted to do is talk to you a bit now about sort of where have we come from, how far have we gotten, and what's next. So what's the state of the field, and also what do we need to do in order to develop the field further in a way that represents sort of the state of the art, where we can have more impact than where we have had already. How do we move this? Trying to figure this out. Hold on a sec.
There we go.
I want to say something courageous about love and light. I want to talk about solidarity, but the words seem to escape. My eyes are tired as rivers of sorrow. From the depths of my heart tell a story of betrayal. I want to be strong, but I know how weak I feel, so alone and isolated. This is the beginning of a poem written by Brother Jiwan Chanika from Canada, who graciously agreed for me to present the poem today. And the poem talks about January 29, 2017. How many people here are familiar with the events that we're talking about? Okay, one hand in the audience. We're talking about the Islamic Cultural Center of Quebec City, where somebody walked in and shot and killed 6 people and 19 people were injured. This was a very big event. And yet we're not really familiar with it. A lot of us don't remember the date. And this is an example of sort of what's happening nowadays, where there's lots of victimization of Muslims, people who are being killed, and we don't even remember it. The person who was arrested, Alexandre Bissonnette, he was a far-right, white nationalist. This is an important event because it shows that some of the experiences we have in the US sort of transcend borders. The same things that we see here in the US, we see in Canada and other parts of the world. So I want to talk about the experience that's represented in this poem, the experience that Muslims are facing. And we're going to talk about it from the point of view of research, what's happening in research, what's happening in terms of cultural competence training programs for clinicians or mental health practitioners. What about community-based programming, things that are actually done in the communities to support the Muslim community? And then finally end with advocacy. And the poem goes on to say, drowning in the silence, drowning in the noise of hate, knowing my life means so much less because of politics and fear-mongering. Watching never again unfold here in Canada. 1 year after a terror attack that was never called terror, because terror only has black or brown skin. While I worry for the lives of my children and my sisters, especially those who wear hijab, and my Sikh brothers who wear the turban, as we live a story that is not new, a story repeated from the indigenous, black, women, LGBT, people with disabilities. Now we, Muslims, are the other. The poem really highlights the consequences of being in a situation where you're afraid, where you're targeted. And this othering, this situation of othering, is the core of what the research we focused on has been focusing on for the past few years. So let's review what's been going on in terms of research. For the purpose of this presentation, I conducted a literature review using PsycInfo. I was looking for any articles, journal articles or book chapters written in English, focused on Muslims living in the United States or in Canada, and in addition to that, articles that have to do with that are relevant to mental health related to Muslims, such as cultural competence articles that are, that cross different cultural backgrounds. The abstracts that I reviewed, there were over 1,000 abstracts, focused, the ones that I selected focused on mental health, or focused on general well-being, so individual well-being related to psychological distress or psychological wellness, as well as collective well-being, such as acculturation or adjustment to society and things like that. I did not include more sociological abstracts or articles that talk more about politics or citizenship and things like that. And what we can find in terms of the trends of the publication is that over the past 20 years, there was a big jump after 2001, so we're looking at after 9/11, that we've had an increase of publications slowly, year by year. The number of publications developed. Prior to that, we're only looking at like maybe 4 to 6 articles per year. Sometimes there was 0. And then it sort of tapered off, or I would say plateaued. And for the past few years, we've sort of produced around maybe 19 to 25, an average of 25 articles per year. That's not much, considering the situation that the Muslim communities are facing. That's not much, but it is better than it was before. And last year, 2017, there was a big jump for 39 articles published during the year, and it's not clear if this is an anomaly or something special, or we're moving to a new level. But there was a jump because of the issues related to the Muslim ban and the issues related to the policies that Trump instituted. So what are the topics that are covered by the literature? Well, there's very little cohesion or any volume in any particular topic. So a couple of articles related to alcohol use, a couple of articles related to prosocial behaviors, etc. We can see that the literature was catalyzed, I would say, by the Journal of Muslim Mental Health. A huge chunk of the articles that are published in that journal. Now, whether the journal sort of facilitated the development of these articles or encouraged it, or whether these articles gravitated to the journal because of the title, we don't know, but it seems to be an important vehicle for producing information related to Muslim mental health. But what we do see is that a lot of the research is dominated by or influenced by specific researchers. So if somebody's interested in domestic violence, they do a series of studies related to domestic violence. Somebody's interested in family therapy, they do a series of studies related to family therapy. And this is a serious risk, because once that researcher stops doing research in that area, 0. We don't have publications in that topic anymore. So the fact that it's so scattered and it's so influenced by these researchers is a problem. We also see that a lot of the topics are influenced by the dominant culture, the things that people in the United States or North America are focused on. So lots of articles about hijab and oppression of women, the status of women, and how that impacts mental health. Lots of articles about the LGBT community. And then outside of the issue of mental health, if we go beyond that, we're looking at articles related to what makes a Muslim a terrorist, right? What makes them become an extremist? So the fact is that a lot of the articles are influenced by the discourse, the public discourse around us. And I'm kind of wondering if it was the Muslim community that determined what the topics are that we would be publishing on, I think that maybe the topics that we would have produced might be a little different. But it shows to what extent we've been influenced by the sort of narrative that's been spun around us. And these are, of course, very important topics, but there are many other topics that may have been produced or may have emerged had we been sort of developing from ourselves. And I would think we'd probably have more articles related to marriage and courtship, maybe the role of the mother-in-law in the family. There's other things that are important to the Muslim community that we're not really seeing, right? So it's an important area that we need to develop further. Now, in terms of the overall literature, I'm not talking about Muslim mental health literature, but literature in general related to psychology and mental health and all the different practitioner fields, we can see that there's a lot of information that documents a heightened impact of explicit discrimination. So we're talking about reports by nonprofit associations and literature by increase in interpersonal crimes like hate crimes and other kinds of discrimination, media showing very negative rhetoric related to Muslims, organizational discrimination, including discrimination in employment and housing and education, as well as in schools in terms of the curriculum and the teachers. We're also looking at structural and institutional discrimination if we're talking about the police, as well as national policies like the travel ban and other kinds of things. I was going to put a picture of Donald Trump, and then I said, no, I don't want to have him on my presentation. And then we also have research that looks at implicit prejudice. And this is prejudice that people are not quite aware of. They might think that they're not really discriminating or prejudiced against Muslims, but they do act upon it. These are experimental psychology studies that kind of study unsuspecting participants where they're exposed to some kind of neutral stimulus or stimulus that have some kind of priming towards the Muslim community and seeing how people may react differently. And we can see from that research that Muslim names, in terms of employment, Muslim names are less likely to be called in for an interview for employment, less likely to be offered a job, have less positive interviews, and more likely to be seen suitable for low-status jobs, especially if they're wearing a hijab. We also see research that shows that in terms of housing, Muslim names or Arab names are less likely to receive a return call from landlords if the name is Muslim. Mock juries are more likely to view a female defendant as being guilty if she's wearing the hijab versus if she's not wearing the hijab. And some of the moderating variables that may impact the relationships or the impact that can buffer some of these processes. We know that spirituality, religious coping, and social support are the three that we see most often, although religious coping has shown some contradictory results in the literature. But for the most part, we're looking at these as being the factors that have been studied that seem to support reducing some of the stress and protecting people against developing these mental health or health problems. And then gender seems to be a major moderating variable as well. Women tend to face a very different situation than men do, especially if they're wearing the hijab, in regards to the amount of discrimination, the type of discrimination, how it impacts their stress, how it impacts their distress, their final psychological impact. So that's something that seems to be also important. So it's really wonderful that we have enough research that we can kind of put together a model like this that maybe somebody can use to test, using structural equation modeling or some kind of other path analysis. But there are limitations, and the same limitations we saw in the literature from 10, 20 years ago, we still have today. We have a problem with accessing samples for people to participate in research related to Muslim mental health. There's a lot of stigma related to the topic. The community gatekeepers, even if you're a member of the community, it's hard to access participants. People don't want to air their dirty laundry. They're afraid that the research has something to do with surveillance, and this is another way that we're collecting data on Muslims. And so there's a very difficult, challenge of trying to access participants. And when we access participants, they are the convenient sample. It's the people we can access, that we can somehow manage to get. So we're using non-probability samples, which are of course very biased because they are just the nature of who we can connect with. And how do we connect with people? It's usually to the mosques, to the community centers, so we're really targeting more religiously informed samples, people who are more committed. So these studies are not really representing the Muslims who are living in the United States who are not mosque goers or who are not committed. Most of the studies are based on very small sample sizes, 100 or 120, with the exception of research that's coming out of Michigan. And then, of course, the conflation of ethnic and racial background. Either we're talking about Muslim Arabs as if that's the same thing, or we're not specifying who are the Muslims we're talking about, so we don't know who they can be extrapolated against or what kind of communities we can generate against. So these are the limitations in the study. Most of the research is focused on case studies. A lot of the literature is using instruments that were developed for other ethnic and racial and religious groups that haven't really been, explored in terms of their psychometrics in order to ensure that they are valid and reliable. So these are problems. Another major problem that we have is the issue of the focus. That a lot of the research focuses on presents the narrative again of victimization, of deficit. This is a problem in the community, This is literature where basically the articles are saying, okay, this is the wound we have, let's open the wound and see what it looks like, right? Where are our stories of resilience? Where are the articles that focus on strengths? Where are the articles that focus on assets? You can pay as much attention as you want to the problems, but that's not going to take you to some kind of solution in the future. All these articles have at the end of them maybe a paragraph that talk about, at the end of what are, suggestions or recommendations for the future. But you know what? If we had more research that focused on exploring and documenting and analyzing the strengths and the assets and the way people are coping, then that will directly translate immediately into more effective outcomes and more effective programs that we can use to help the Muslim community. So there is a problem with the way we are looking at the field. So what do we need to do to move forward? Well, as I said, we need to focus more on resilience and strengths and try to document and research some of those aspects and some of those constructs. Of course, we need more research related to children, families, relationships. You have lots of Muslims in the, who are facing cases of, who are in the courts because of civil or criminal cases, but we don't have literature to support those kinds of situations. Severe mental illness, of course, treatment outcomes, and prejudice reduction program. The one area where we have a lot of literature and that seems to not be focused on a lot of these constraints of the characteristics of the clinicians or the researchers is the issue of cultural competence. There's lots of articles on cultural competence out there. Those articles tend to be based on personal assumptions and observations. They're not based on evidence. We need evidence out there so that we can make decisions and we can move forward. We want to look at doing other kinds of research. Participatory action research may be a way to reduce some of the challenges of accessing the community when you have community members with you on the team developing the project from A to Z. So any of those kinds of action or participatory programs, they're more empowerment oriented. We want to look at experimental designs, especially for developing programs, and we want to see how effective they are. Longitudinal designs would be very helpful for people, especially immigrants or people who are staying here for a longer period of time, to see how we can track them over time. And also creative methods, other ways to access. I was working on a project at Yale University that was directed by Pia Brito, and we were looking at Muslim Arab youth in the New York, Massachusetts, Connecticut area. And we had to resort to, I don't want to say resort, but we had to develop very clever and new ways to access the children for the studies. We developed a song for the study. We had parties. We had a Facebook group. We had these kinds of things you don't usually see in the literature, but this is something we may need to look at. And by the way, I do have an article that I wrote on psychological research of Muslim Americans in the age of Islamophobia. It's published in the American Psychologist, and I have reprints, and it's at the top of the hall if you want to take a copy before you leave. And it basically summarizes some of the challenges of research and gives some suggestions for how we can move forward. And I really hope that because of the paucity of the literature, that everybody in this audience thinks about publishing what they're presenting at this conference or anything else that you're doing. We really need the work to be out there. If it's not out there in terms of scientific literature, at least publish it on websites or publish it in reports of community organizations. And another area that we really need to move forward in is using that literature for policy, for making changes. Avec Quebec, whose politicians have forgotten us, even those who claim to speak social justice are silent. I'm exhausted by the platitudes of politicians and leaders who speak words, but never change their actions, silently watching their neutrality engulf us in tides of hatred and white supremacy, cloaked as free speech. Can't call the hatred against us what it is, Islamophobia. And this Islamophobia is pervasive. We're not just talking about politicians. We're talking about teachers, employers, we're talking about service providers, universities, professors, and even mental health practitioners. And that's why it's really important for us to continue the work we're doing in terms of cultural competence training. A lot of the clinicians that work with Muslims are misinformed, they're impacted by what they see in the media, and so it's very important for us to develop better trainings. Now, we've had a lot of trainings. I remember the first training I developed in 2000, that was before 9/11, and then after 9/11, the amount of trainings became, it really expanded. We have lots of different types of cultural competence workshops, some that range from half an hour to more than a day. They are targeting different audiences, different types of professionals, and I think maybe what's expanded in the recent years has been maybe the vehicle of the delivery of these trainings. So we're no longer looking at in-person trainings. We also have online trainings, continuing education programs, videos, and things like that. Now, what are the contents of the training? I did a study a few years ago, and I kind of looked at some of the recent research or the recent trainings to kind of compare. It seems to be pretty similar. So some of you have seen this before. What are the contents of the training? Most of these workshops focus on explaining what is the Islamic faith, like the 5 pillars and the Quran, trying to negate some of the misconceptions about women and jihad, explaining some of the ethnic or cultural values and traditions, especially if the training is mixing Muslim and Arab or Muslim with another particular group. Attitudes and barriers to seeking formal services, so the issue of stigma comes up in a lot of these trainings. And then, of course, explaining some of the socio-demographic and population statistics. What's the percentage of Muslims in the U.S. who are black versus, South Asian, etc. Suggestions, some brief suggestions for increasing service access in youth, the impact of 9/11 on stress, and immigration, refugee status, acculturation. And then some of the workshops, especially in the healthcare settings, focus on concepts related to life or death and dying. This study was done with 57 people around the U.S. who were doing these workshops. And again, if you look at the current trainings that are offered nowadays, it's pretty much similar. Where are people getting the information that they're incorporating in these cultural competence programs? If you're doing these programs, take a look at the slide and see if you agree that these are the sources where you are collecting your information. A lot of it is based on personal observation and common sense. The bulk of people, 60% or 56% of people say that this is where they develop. They know about Islam. They live with Muslims, or they are Muslims, so they think that they know what they can say. General literature on Islam is about homosexuality, a question about the contradiction between Islam and culture and what people do. You're a presenter, you're telling me this, but that's not what I see Muslims doing in another country, so can you please explain that to me? The issue of terrorism and perceived hatred, big question. Lots of people, if you've given trainings, you've heard this question. Why do they hate us so much, right? This question comes up. And political issues in other countries, as well as the issue of Sunni versus Shia. These may not be big questions or issues here in the community in the United States, but because the media presents them to be very big questions, then the audience starts to ask those questions as well. So we need sort of helpful responses of how do you respond to those kinds of common questions. And I really hope that if anybody here is working on these cultural competence trainings, that you can commit, today, to working on developing some of these needed resources. We can't continue what we're doing of giving these trainings in isolation one by one, and we're just giving these presentations. And what else do we need to do when we move forward? Well, first of all, we need to work on developing training programs and workshops that are more experiential. We've had decades of behavioral research that shows that simply giving information does not lead to behavioral change. It does not lead to reducing prejudice. If that was the case, we'd have a lot of people who stop smoking after they know how bad smoking is. This is a problem that our workshops and our trainings are focused on giving information. We need experiential programs. That means that within the didactic program, you could have experiential games or exercises, activities where people are on their feet, developing something, learning something, and then having a debriefing session after that to kind of explore the impact of that. And also other forms of training people to be culturally competent that are not focused on giving some kind of lecture or presentation. What about an entirely experiential program, like something that incorporates some sort of consultation or some kind of mentorship that's over a certain period of time where you're working with the person directly on their cases? We also want to develop programs that focus more on the applications rather than the theory. A lot of our trainings are focused on, this is what Muslims believe, this is where Muslims live, this is what Muslims look like. And then the clinicians leave the trainings and they're like, okay, well, I now know who the Muslims are, but I'm not any step further of knowing what do I do when I have someone with me in the clinic. We have to develop trainings. We need to have information on applications. What kind of therapies work? What kind of methods can work? And in order to do that, we need more evidence. So once again, we need to develop more research, and the research has to be applied. We need to figure out what are the characteristics of mental health services that are more effective, what are the things that people need, what are the things that people benefit from, and we have to avoid these assumptions that we keep perpetuating. I can't tell you the number of times I've gone to a workshop related to serving Muslims or how to be better in offering services for Muslims, and the person who spoke said something like, what do Muslims do when they have a problem? Who do they turn to for support? Well, actually, Muslims go to the religious leaders for help. That is not true. The evidence that's in the literature shows that Muslims in the United States do not turn to their leaders for support as much as they turn to other sources of support, both religious and non-religious, including friends and family, etc. And also comparative literature shows that if you're looking at different faith groups, that Muslims are less likely to look for support from their religious leaders compared to other faith groups in terms of including Christian groups. But we keep perpetuating these same stereotypes, these same assumptions. Why? Because we haven't done the research. And the few pieces of research that we have out there are not being integrated into our program. We need the evidence, and we need to start integrating the evidence. And we also have to work on developing programs that are nuanced, that don't just present Muslims as this big monolithic group. We already have a problem of stereotyping Muslims in the media, and then we have people coming in for a training, and we stereotype Muslims in the training, and people who attend these trainings, they can't negotiate those differences, because there's no nuances. They listen to the training and they say, what you're describing is not the Muslims that I see. You say that Muslims wear hijab or they're religious or whatever, or they don't shake hands or whatever, and all the Muslims that I see coming to my clinic are not wearing hijab and they shake hands. So what are you saying? We need to develop programs that are more specified. What type of Muslims? How religious? What ethnic background? Are they immigrant? Are they born in the United States? We have to develop these programs that are tailored to the communities we're working on. And better yet, if we are focusing once again on trainings that are more experiential, we wouldn't have to do that, because people would be developing themselves as clinicians in a way that would make them less prejudiced and more open to offering services and more able to access information they need to offer the services. We wouldn't have to be offering these little specific pieces of information about the communities that we're offering. And that's in the clinical setting. What about in our mosques? And our mosque, supposed to be sanctuary, is now cloaked in safety protocols. My hands are shaking as I write these words, as I prepare my heart and mind to smile tomorrow, Jan 29, to answer, I'm okay, to the random how are yous, to hide my tears and fears for a tomorrow where some do not see us, as I hold the deaths of fathers like me who will never see their children grow. So what about interventions for our own communities? What about interventions that we can have in our own mosques? Well, there are a lot of work that's being done at the moment in terms of developing programs for the Muslim community. I'm going to highlight some of the issues that I think we need to address. Many of you are already working on these issues. Many of you are presenting this conference on those issues. We want to work on more programs related to developing stronger community ties and sense of community. We have a lot of political infighting in the different Muslim communities, particularly from the different ethnic backgrounds. We can't deny it. We need to work on trying to see how we can improve those relationships so that we can have a strong voice moving forward. Develop safer communities in terms of being targeted from racism and discrimination and things like that. Working on tolerance programs that promote more tolerance to Muslim communities, reduce prejudice, things like that. In terms of communities, there's this myth that Muslim Americans, especially immigrants, are, have a higher, disproportionately high, socioeconomic status. We're talking about people who are very educated and affluent, but also the fact is that a lot of the Muslim communities are disproportionately lower in terms of socioeconomic status and education compared to the mainstream American community, especially refugees and people coming in from certain countries. So we need to take that into consideration and develop programs to target and support these communities. We also want to look at more programs related to enhancing courtship, family ties, relationships, preventing premarital counseling, for example, divorce issues, all sorts of, avoiding domestic violence. Also, of course, programs related to children. This is a pretty challenging area, but it's great to know that some people are already working in these areas in terms of enhancing child resilience, preventing bullying in the schools, enhancing the school climate so that it's less prejudiced and teachers are more informed. Also enhancing accessibility for persons with disabilities, working on identity development and acculturation, obviously mental health issues in terms of reducing mental health problems and enhancing health and mental health in general, and then working on developing practitioners. So community practitioners like the imam trainings, those can be very powerful as a source of support for the community, as well as developing more trainings for professional development and professional mentoring of Muslims and non-Muslims who are working in the community. If we're working on these programs, we need to consider some things. We need to consider the reach of the programs. Who in the community are we targeting, or are we, as usual, presenting some kind of program that is, preaching to the choir, for example? The dosage and intensity, you're probably going to be very unlikely to make a change if you have like a half-an-hour workshop after Salat al-Jum'ah, for example. That's not going to make a difference. The quality of the training has to be high, and also we need to make sure that it's culturally sensitive. We can't just take programs that have been developed for other cultures and import it and apply it without really considering their impact. When we look at moving forward, I hope anybody here who's working on developing a program or is thinking about developing a program, that you move forward using this sort of cycle of how to develop an effective program. The first step is always needs assessment. Is this program needed? What are the issues that the community face related to that? You can't just come in based on your observations and say, oh, I see that there's a lot of people here who have domestic violence. I'm going to do a program related to domestic violence. Maybe that's not a priority for the community, and that's why a lot of programs fail, because they're not well targeted to what the community wants. And I'll give you an example. I remember one time I was working with a group of people. We wanted to do a program related to, oh, thank you. Everything is see-through on here. We wanted to do a program related to post 9/11 depression, anxiety. We thought the community was suffering, so let's do a program. Then we said, let's do a needs assessment first to see what's going on. So we collected data from all the different mosques in the community and all the community centers, et cetera, et cetera. Guess what was the main area or issue that the community members said, this is a mental health problem that we need help with? Guess. Anxiety?
Parking.
Parking? That's probably better. That's probably more aligned with the situation. Healthcare? Depression? Well, it wasn't anything that we had thought of. The number one shared, and people from all different ethnic backgrounds and all the mosques agreed on it as being an issue that mental health practitioners should work on, is the issue of finding somebody. And the dating pressures, so the courtship issues, that was the big thing. And then the second highest rated issue was smoking. And we wouldn't have noticed that people are smoking because people don't smoke in the mosques, people don't smoke in the cultural centers. We didn't realize that that was a priority or problem in the community, particularly in the Arab community. And so this is why it's important to do a needs assessment, to know what is the community needs and then target it accurately. Then you want to develop the program. You want to develop the program based on scientific evidence and research. We want to develop sort of a theory and use the evidence to develop an effective program, implement the program, and then evaluation. You always want to evaluate. You always want to collect information before the program, after the program. Was there a change? How effective was it? And if it is effective, what makes it effective? And then have that published or presented somewhere outside. So this is very important. Throughout all of this, it's very important to use more of an empowerment-oriented or participatory approach. Get the members of the community with you developing these programs. Don't just come in as an expert and say, hello, I'm here. Here's my new program to reduce bullying or reduce substance abuse. No, have the community members join with you, and then there'll be less resistance and people will be more involved. We will not forget. And perhaps it is here where I draw my strength. I will not let their lives be lost in vain. Where there is silence, I will raise my voice. Where there are only words, I will take action. When they erase us, I will be visible. Where they will tell us we don't belong, I will speak the truth. This is our home. When they erase our history, I will remind them that we were here before Canada even had its name. When they tell us to be like them so we can belong, I will unapologetically be who I am. And this takes me to the final issue that I want to talk to you about, which is raising our voice, which is the issue of advocacy. A lot of us are not involved with advocacy. A lot of us, we go to work, we see our clients in the clinic, or we work in some kind of program, we go home, and that is it. But we can't sustain our field with these kinds of methods. We need to move forward. We need to speak up. So in the last minute, I'm going to talk to you about how we need to advocate more. We need to advocate, we can't just accept the givens of society around us. We need to make a change. So each and every one of us really needs to speak up, to have a voice. Whether you're advocating for an individual child or an adult, somebody who needs services, who needs some kind of help. Whether you're advocating for a neighborhood or a community to access the resources that it needs, or to receive the attention that it deserves. Whether you're advocating against national policies that are not in line with the benefits or the needs of our community, we need to advocate. We need to advocate if we see something with our eyes that is misleading, whether it's in an article in a scientific journal or whether it's something that's written on a billboard in the street. We need to advocate if we hear something that is wrong, that's not correct about our community, whether it's we're hearing something discriminatory from a politician, or even something that's being said by a psychology professor or a social work professor. And how do we advocate? We need to write letters, we need to make phone calls, we need to join others. Whether we're walking out or sitting in, whether we're marching or we're standing or we're rallying or we're striking, we need to stand up. We can't just sit in our offices the way we've done before. We need to establish coalitions with other groups. We need to establish organizing with communities so that we can move forward. The theme of this conference is Out of the Shackles, Pursuit of Civil Justice in the Face of Psychological Trauma. How do we break these shackles? It's not going to happen unless we speak up and we have a louder voice. And that's not going to happen unless each and every one of us becomes an advocate in addition to whatever we have been doing before. Advocate, advocate, that's all I can say. And this is something that's part of our religion. Our religion teaches us to fight for social justice, to speak up when we see something that's wrong. And like the prophet, peace be upon him, reminded us, when people throw stones at the date palm tree, it gives fruit in return. Be like the date palm trees. So where the date palms meet the maple leaves, I will bring who I am fully into being. Though my heart is tired and my soul is shaken, my resolve is firm and I will not back down. So today and tomorrow, I will remember my brothers, Mamadou, Ibrahima, Izzeddin, Khalid, Abu Bakr, and Abdul Karim, their 17 children and their families. I will stand to honor their lives and their deaths, and know, no matter how heavy the burden may feel, we all have a responsibility to carry their legacies forward. And I hope you join me in doing that. Thank you.